I'm Dr. Jamie Kaufman. This is Dr. Kaufman's Reflux Hour. Happy New Year to everyone. We're going to take a much more aggressive approach to reflux this year. And today's topic, are there reflux triggers, could not possibly be a better one. And indeed, people ask me all the time, why did I get reflux? So what I'm going to do is and by the way, the questions fit in beautifully. And the questions are, if I take this screwdriver and I turn this screw a little bit, is my car going to run like a Ferrari? So the idea that there are small adjustments that make a big difference, that ship sailed in 2024. So stop asking me about slippery elm and those things, because these are the most, how shall we say, modest of possible adjunctive treatment. So I'd like to talk first about lifestyle triggers and then trigger foods. And so I'm going to start with the top 10. 5 of them are lifestyle and 5 of them are foods. And then I'll give you 5 more honorable mentions of the 10 foods, honorable mention ones. So the number one reflux trigger is eating too close to bed. If you go to bed with a full stomach or even a half full stomach, you're going to have supine nocturnal respiratory reflux snore. That's the name of the blog. Okay, so type in snore on jamiekaufman.com and you'll get that article. It's the basic pattern that most people have today. Most of you have silent nocturnal respiratory reflux. Most of you don't have heartburn or indigestion, and most of you don't wake at night. But you have snoring, sleep apnea, asthma, sinus disease, shortness of breath, swallowing problems, and so on. So silent nocturnal respiratory reflux is tricky. Number one, because you don't necessarily know it's reflux. And number two, because your doctor's probably clueless. No one teaches this in medical school, respiratory reflux. By the way, respiratory reflux is a new term that replaces LPR. What about the sinuses, the breathing, and so on? So I am 77 years old. I eat 5 o'clock. If someone comes later, I'll eat between 5 and 6. But I go to bed after 1. It's interesting what risk factors are. I haven't refluxed in years, and a bad back, and I was lying down on ice after I was eating, and I started to get reflux. So the solution for me was a lazy boy. I still use the ice, and I still use the back support. So eating too late, snacking. I had a woman who was a consultation, a nurse, by the way, who said that she eats chocolate before bed every night, and she wasn't going to stop no matter what I said. So I thanked her very much and said the consultation's over. So if you're eating chocolate every night, if you're having a snack late, you're going to have reflux all night, and you're going to have other symptoms that are not so obvious: postnasal drip, chronic throat clearing, a sense of a lump in the throat, and shortness of breath. And I might add, I want to talk a little about shortness of breath when we get to symptoms, because things have changed. Shortness of breath is now the second or third most common symptom of respiratory reflux. So we'll get there in a moment. So eating too late is number one. Snacking before bed. The worst possible thing you could do is have a nightcap. Let's have a scotch neat before you go to bed, because we're friends and we're going to make a great deal. So forget about that. Third is overeating, particularly in the evening. If your stomach is basically like a balloon that's been overinflated, surely you're going to get backflow. So learn not to overeat. Okay, when you pick your plate and you put on it, you don't need to have, as my son does at least Thanksgiving is 2 o'clock dinner, a plate which is piled to the sky. So overeating is unnecessary and unwise. Fourth, there are medicines that cause reflux. In fact, the same son who makes the big, huge plate at Thanksgiving called me, I don't know, a year or so ago and said, I'm having this cough and I think I'm having reflux in the evening. And I said, how long has it been going? He said, two months. I said, has anything changed? Well, my doctor put me on blood pressure medicine about 3 months ago. ACE inhibitors cause reflux, cause cough. And if you have reflux, you should not be on an ACE inhibitor. These are the most common blood pressure medicines used in America today. And you don't need to be on an ACE inhibitor. In fact, I took him off his ACE inhibitor, asked his doctor for another kind of blood pressure pill, and all of it went away. Good news. And finally, obesity. And I wanted to talk about obesity. If you have, if you lie down, if you've got a big bunch of big paniculus, and you lie down, there's 50 pounds pushing on your stomach. So you have basically increased intra-abdominal pressure. Now, I'm going to tell you that the idea that people should take a Ozempic or something like that for obesity is cruel. It's just dumb, okay? It's basically never going to get the thing done. It is, in fact, those drugs I've written in post cause reflux. So the idea that you'd lose weight by taking a pill, it's really, really simple. You take in fewer calories than you burn, and you lose weight. I was a 217-pound sugar addict, I don't know, 30 years ago, and I changed over to using the sugar turned out to be figs and dates and apples. And then I, over the course of 2 to 3 years, went from 200 and something pounds to 148 pounds. I've been 148 pounds now for 20-something years. So this whole idea that you're going to do something, you're going to tweak something, and you make your reflux better is not going to fly. This is a lifestyle, and it represents significant change. Let this be a platform for change for you. You recognize that this is going to have long-term implications if you want to live to be a healthy old man or woman or something in between. Then you have to make a lifestyle change, and it's not just during a 6-week detox program. So, surprise, surprise, the number one trigger food is alcohol. Alcohol makes the lower esophageal sphincter relax. If you're going to bed with a buzz, you have, in my opinion, 100% chance of refluxing all night. You wake up in the morning often with a whiskey voice, and mucus, and even a bad taste in your mouth. So it turns out that the best way to drink is to not drink at all. I used to smoke and I used to drink, admit, and I decided that I wanted longevity, that 77 wasn't enough, and I wanted to have good life and good quality of life. And so I quit smoking and drinking and also changed my long-term diet substantially. And that's not just for a week, for a month. That's for really for the rest of my life. So when you talk about how long do I have to do this, and the answer is, if you still have reflux, you're not doing it right, and if you are doing it right, you have to do it forever. Fried food, 30% of the American diet is fast food. It's the usual, burger with cheese and bacon and Coca-Cola and fries, okay? It's just, we spend $1 trillion a year to get sick. Going back to when I was a kid, there was no obesity. There was like one fat guy. There was no asthma epidemic. There was one kid with asthma and allergies who walked around with a box of Kleenex. Okay? There was none of it. We didn't have sleep apnea. Very few people snored. Usually it was the fat guy. So understand that these diseases, and all of them, follow the path of the American diet since the 60s. Okay, so before 1965, we didn't see any of these diseases. High-fat food in general, if you're going to have cheese, you're going to have something grated on your pasta, that's fine, but stay away from the triple creme cheese, stay away from the high-fat foods. Again, just like caffeine, by the way, and just like other things, the lower esophageal sphincter relaxes. Carbonated beverages, it's interesting, there was something on the news, or David, no it wasn't, it was one of the comedians had a thing, said if you drink a Coca-Cola takes 12 minutes off your life for each Coke. If you have, 6 minutes, if you have a hot dog, it takes 12 minutes off your life. And all of the things he mentioned were all the things that cause reflux. So, the worst thing you can do is drink carbonated beverages. Acid activates pepsin. If you don't know what pepsin is, you should read, if you have a dropping acid book, read the first 45 pages. The diet's on page 46. And finally, a chocolate. Sorry to say chocolate's a big trigger food. For me, when I had bad reflux, I could behave myself for a whole week, eat one chocolate chip, and be refluxing for the weekend. Now, whatever it is, 30 years later, I am enjoying chocolate, but I don't eat it at night. caffeine plus. Got theobromine. By the way, I've written blogs about all these, posts about all these things. There's a good one on chocolate. And there's a good one on snacking for bed. There's a good one on fried food and so on. I'm going to just give the honorable mention to high acid foods. Citrus and lemon juice are not a good idea. Again, it activates pepsin. Coffee is a trigger food for, I don't know, I think about 15% of people. I was one of them. I loved coffee. I had a very expensive machine that made cappuccino and the whole deal. And I got up one morning, I don't know, a year ago perhaps, and I had my coffee. It had been bothering me a little bit, and I went and I threw up. And the next day, I got my whole tea, if you will, tea area ready. It turns out there's 90 milligrams of caffeine in a cup of coffee. If you need it to get started, there's 60 milligrams in a black tea, like English breakfast tea. So I start my day with 2 English breakfast teas instead of coffee. And you should read the article on caffeine and coffee. The amount that you should have is probably about that much, 120 milligrams, 150 milligrams max over the course of a day. That said, if you have coffee as a trigger food, not caffeine, then you'll have the same symptoms with decaf as you will with caf. So, next come onions, garlic, and peppers. These are very idiosyncratic. In each case, it's less than half of the population. I never had a problem with any of those except onions, and raw onions and sharp onions are worse than sweet onions. Particularly, for example, I have an onion post. Vidalia are sweet onions. They're caramelized, and they're not reflux triggers, I don't think. So the question, one of the questions, the first questions I have here is, I just want to let you know that I'm singing again. My voice is better than it's been in 10 years. It took about 6 weeks of following your directions. Thank you so much. So I need to keep living like this to maintain forever, for the rest of your life. And your voice will get better. Now, you have to figure out which of the variables are most important. Is it how late you eat? Is it maybe you should sleep on an incline? Maybe you need the famotidine and the alginate. So you have to figure out which of the variables is most important to you. Lifestyle changes. You want to get rid of your reflux, not just take a pill and make your heartburn go away. Eating early, period. Early eating. No snacking after dinner, no fast food, minimum or no carbonated beverages, no tobacco or vaping. Nicotine makes the lower esophageal sphincter relax. With cigarettes smoked, 88% of cigarettes are associated with a reflux event. No alcohol, and then identify your reflux trigger foods. For example, white wine is a big trigger food for some people. And for example, even bananas. I think I've told the story before. A woman who was an editor at the New York Times, an older patient of mine, and a friend, called me and said, I'm having heartburn every morning at 11 o'clock-ish. And I said, what do you have for breakfast? She said, well, I have the same thing every day. I have oatmeal with raisins and a banana. I said, stop eating the banana. For 5% of people, even though we love bananas, it's a trigger food. So you have to think about things. What did I eat last night? How do I feel this morning? Or even if you had symptoms the same day. And for some people, it requires being as diligent as keeping a food log. So the singer, I want to mention, I'm not going to get to that. If you read my most recent article on alkaline water, you're going to see these little bottles. And these are really, this is like a thing on Broadway now. And believe me, I didn't see all those people. If you have reflux at night, silent nocturnal respiratory reflux, you have pepsin on your vocal cords. Pepsin causes inflammation. It's acid activated. But pepsin dies at pH 8. This is my 9.5 alkaline water. That's all it is alkaline water. It feels good too. So take a look at that last article on alkaline water. Gets me to my next question. I read another social media site that drinking alkaline water will only increase acid production in the stomach. Would I say that's the stupidest thing I've ever heard? Yeah, it's absolutely, totally nonsense. There's not even a possible mechanism for that. There are people, millions of people who drink alkaline water every day. That's what comes out of the ground where they live. There are no side effects with alkaline water. None. So, no, it doesn't make more acid to make your reflux worse. So it got me going, that one. What is the purpose of Gaviscon and how do I use it? If you look at my reflux detox program, you'll see that we're hitting from several different vantage points prevention of reflux. Gaviscon and other alginates, and the ones that are now in most common use besides Gaviscon Advanced, and it's advanced, gets on Amazon or something. Don't buy it in the pharmacy. That's an old, not a real alginate. Gaviscon Advanced, Reflux Raft, and Reflux Gourmet, the least expensive, and the one that has the longest run of actual study is Gaviscon Advanced. I recommend the liquid. Take a swallow after dinner and a swallow before bed. What it does is it rises to the top of the stomach, forms a raft, and helps block up the lower esophageal sphincter. So I think that's one of those things that people should keep doing over the long haul who have had this kind of up and down reflux for many years. I hated that social media. Alkaline water causes acid production. I mean, really? It neutralizes acid. Period. Can acid reflux, this is a great question, by the way. Can acid reflux cause heart palpitations? Had a full workup with my cardiologist. Now, remember, when I was in practice in New York, I was putting a pH probe in the throat. Only person who's ever done it, high quality, is FET chip. The same chip, you buy a $1,000 pH meter. That's what I was testing. So we had someone who was having palpitations, and we had 24-hour pH monitoring, and we had one of the cardiac monitors. I can't remember the name of them, the ones that go for 24 hours or more. And indeed, we saw arrhythmias. We saw arrhythmias with some of the reflux events. So reflux, remember the vagus. The vagus runs the cardiovascular system, pretty much all of it, runs the digestive system, runs the respiratory system. So there's a question here about the vagus that I'll get to in a moment. But the answer is it can, and I don't know if just treating the reflux is enough. I think it is. I love this question. And I'm going to run out of time on this one. We're gonna do this trigger hour again. I have had shortness of breath for 5 years. My doctor said I have asthma, prescribed Advair and inhaler, and none of it helps. What can I do? Now, it turns out shortness of breath, we've been keeping track. I have data. 42% of people who consult me. Now you could argue, well, those aren't typical GI patients. Maybe. 42% of people who consult me have shortness of breath. Okay, so postnasal drip, chronic throat clearing, and shortness of breath. Okay, and way down at 10th or 11th is heartburn. So respiratory reflux now dominates, and esophageal reflux with heartburn and indigestion, not so much. When someone says, and I do a consultation and they circle shortness of breath, this is what I say. There are at least 3 types of shortness of breath. The first type is shortness of breath with exertion or exercise. You move your body, you go up 2 flights of stairs. You're too huffing and puffing for 2 flights of stairs. Okay, so that's on exertion. The second type is difficulty getting air in or out of the lungs. And if asthma is an example of that, laryngospasm is an extreme example of that. And by the way, if it's trouble breathing in, it's never asthma. Trouble breathing out only. So, and the third type, I hope they'll name it after me someday. Nobody's ever written about it. It's hard. How would you write an article? By far, 68% of people with shortness of breath have inability or discomfort taking a full breath in. Think about that. It doesn't feel good. And they call that shortness of breath. So that's 2/3 of people, 2/3 of the 42% of people have shortness of breath. So that, we don't know the mechanism. They have normal chest x-rays and pulmonary workups. It has to be vagally mediated. Everything is vagally mediated. Maybe it feels like if I take a deep breath, I'm going to cough. But the inability or discomfort taking a full breath in is reflux and nothing else. I have mild reflux but still want to eat clean. What butter would you recommend? Okay, This is an example of a very, very unsophisticated question. Okay? The idea that changing butter or the best butter, if you have reflux and it's mild, it's probably not mild. You snore, do you have sleep apnea? Do you have sinus problems? Do you have any kind of respiratory problem? So I don't know what mild reflux means, but the idea of it is the best butter. So I'm going to finish with, can you talk about vagal neuropathy and burning mouth? A burning mouth, when I was a resident, everyone used to cringe when a patient came inside of burning tongue, burning mouth. There are more than one mechanism. I mean, if you reflux in your mouth and you're tasting bitter, you can have burning from reflux, but most of it is neurogenic. That means it's nerve caused. It's not the vagus nerve. The vagus is the 10th of 12 cranial nerve, and 7, 9, and 10 operate this area. So we think it's a neuropathy of some kind, and I treat those, or I used to treat those the same way I treat other neuropathies. And in my world, I treat burning throat, voice use pain, and neurogenic cough. And there's an article, a post on how do I treat neurogenic. Neurogenic's not so common. Everybody says, oh, it's my vagus, it's my vagus. It isn't. So turns out that that's going to be one of those. I'm writing a book now, and there's a huge chapter. It's called Respiratory Reflux, How Silent Reflux Causes Diseases. That's the point. You know, you don't have heartburn, you don't have indigestion, you know, wake up in the middle of the night, most of you. And it says that the medical community is clueless. It says that it's hard to diagnose because you don't have typical symptoms. And it says it requires significant changes in your life if you want to get rid of it. And by the way, if you get rid of your reflux, you're probably going to increase your longevity. I've said for a long time, for example, this is an interesting one, you can get cancer from smoking and reflux, but you have to have reflux. So in other words, you can get cancer with smoking, but not without reflux. So reflux is the common denominator in my belief for cancer of the larynx, esophagus, and lung. And certainly I've seen many non-smokers with those. How are we doing on time? We're doing okay. I found that drinking hot water all day has helped. Does that make sense? I can eat more now. Mary, that makes no sense. I think I do want to finish a little bit on vagal neuropathy. 40% of the population has had a vagal neuropathy. That means the vagus has gotten sick with a virus or with something's hit it. Most of the time it's a virus. My story is, on Christmas Day, about 30 years ago, I got up with the flu. I was sick as a dog. 3 days later, I lost my voice. And I examined myself, and my left vocal cord was paralyzed. And 3 days later, I was coughing continuously, and I had all the respiratory reflux symptoms. So before I got the virus, I never had a voice problem. I never had a cough problem. I never had a reflux problem. And so the vagus nerve was right on the lining membrane of the throat. And we think that's where it most commonly gets hit by a virus. I've done a study that's never been published, but actually 40% of the American population, or 40% of the population, based upon a reasonable sample, has had a vagal neuropathy by laryngeal electromyography, actually measure the nerve muscle conduction and find out. But that doesn't mean it causes your reflux. That doesn't mean it causes your symptoms. So all that big group with neurogenic problems, only 5 to 10% need the neurogenic problem diagnosed and treated. I recently did a consultation from a woman in Romania, thin, very, very healthy woman. I don't remember, I think she was vegan, who was a translator having tremendous voice use pain. So that was a profession, was voice. And she needed neurogenic treatment. And so I said to her, there's a PDF, give it to your doctor and go to work. If you read the article, there's a 3-part article on the vagus. The first 2 articles are important. All of them are. The cardiac complications are in part 3. But in part 2, there's a famous actress who had problems, and she got good treatment in 2 weeks. So she was able to go to California and shoot a film in which she had to yell. So understand that Although a lot of us have, and by the way, I don't have any other cough. I don't have any, my vocal cord never came back 100%. I can't sing happy birthday. What happened early when I started to cough is because my vocal cord's mostly paralyzed, a little bit of my own saliva went down the wrong. If I talk and I drink, I often aspirate. And I have to be particularly careful of rice, which I eat a lot of. So a lot of people who have voice problems have reflux. It sounds heavy, the vocal cords are swollen. And a lot of people also have partial paralysis or one or both vocal cords. That doesn't mean that that needs treatment. But understand that if you have this kind of problem and you're not getting anywhere and you're a professional voice user, consider doing a consultation with me. Recognizing that melatonin may relax the lower esophageal sphincter, what's the best sequence for taking bedtime meds, including melatonin, gummy, famotidine, and alginate? Okay, so first of all, famotidine and alginate have nothing to do with sleep, and you should be taking them if you have significant reflux. And there's an article on famotidine, and you want to look at the whole package. There's the just type in reflux detox program in the little box. I don't recommend melatonin for anybody. One of the things that I've been told by fellow physicians is the problem with melatonin is that you tend to require more doses as time passes, and it starts to have problems during the day. I recommend small doses of Benadryl for most people, the smallest dose. And there are other things that are fairly benign. Most of the ones that you take that are prescribed on TV are habit forming, not so much because you need them or want them, but because if you don't take them, you're not sleeping. So I won't tell you what I've been taking, but I've been taking one little pill for the last 30 years, and it helps. I will go back to this question. Dr. Kaufman, in your latest blog about natural remedies, you mentioned licorice and slippery elm. In the past broadcast, you said they're not very valuable. They're not very valuable. If you're doing a program and you're eating early, sleeping on an incline, taking famotidine, eating a low-fat, low-acid diet, taking Gaviscon Advance, chewing gum after eating, using alkaline water and alkaline water spray, by all means, take licorice too. So these are not basic treatments, and for all I know, they may do nothing. That's why, but people like them. I have a question about oatmeal. It doesn't matter whether it's steel cut. It doesn't matter whether it's instant. It doesn't matter if it has some funny chemicals in it because it's instant. It's basically alkaline. The only thing I say about oatmeal is don't eat the same thing every day. If you eat the same thing every day, if there's a trigger food like the lady with the banana, then you're not going to know it. Read my article on breakfasts. I do 5 different types of breakfasts. Right now I'm on my rice phase. So sourdough baking is fine, and it doesn't matter whether it's whole grain or not. Is throat mucus, Lisa, is throat mucus a sign that acid is still traveling up the throat and could be just that pepsin is still present in the tissue? No obvious symptoms of reflux, no burning or chest pains, no cough, cobblestoning. Oh, constant red throat with cobblestoning. I don't know if she knows that. No problem sleeping. So the answer is 90% of the time, mucus is thick. And if it's thick, and by the way, you can have allergies too. Allergies are thin mucus. It's usually associated with symptoms like sneezing, runny nose, itchy eyes, all that kind of thing, ragweed, whatever. And a lot of people have reflux, but allergy never gets on vocal cord. You get thick mucus, it's reflux. So if all you have is thick mucus, know that you've got reflux. And what you do about it is basically your business. Is matcha tea with almond milk okay? I don't know. I haven't had a chance to look that up. Sorry. Dear doctor, this is a tough one. Dear doctor, can you please suggest something to cure slow stomach emptying or gastroparesis? Okay, let's just talk about triggers. I didn't tell you this, but there are really 3 types of triggers that we know about. Type 1 is I eat this, then I get reflux. So, for example, I had chocolate and my reflux went crazy like soon thereafter. There's a second type. I still can't eat black pepper. If I have black pepper, some vagal receptor in my throat makes me cough, and it must be one chemical, as it is in, say, peanuts or bananas, because I can eat red pepper. So I don't eat a lot of them, but I mean, that's the thing. But the third type is you eat something and your stomach goes, I'm not doing this. So the stomach says, I'm taking a vacation from this green pepper. So I found, for me personally, when I had reflux, that that bell peppers were a real problem. And so one of the things you need to do is to look at your diet and see if you have some waxing and waning of this. There may be foods that are essentially triggering your gastroparesis. That said, in the past I've treated gastroparesis with neurogenic medications. I had a nurse who was waking up in the morning with nausea and vomiting and ended up in the emergency room with the usual medicines and sent him home. And he did very, very well on amitriptyline and gabapentin. It actually took a year or so, and then he came off it and no longer had this kind of severe gastroparesis. Hello, Manuka honey is acidic according to Google. According to Google, nothing is right. If you're getting reflux information from Google, good luck to you. Yeah, just remember the alkaline water makes more acid in the stomach. Nonsense, okay? I have no idea whether Manuka honey is acidic or not, but if it's acidic, it's mildly acidic. Just remember, if it's pH 6.9, it's acidic. Only pH 7 is neutral, and above that is alkaline. So that's all I have to say, and I've had covered a lot of material today, and I look forward to seeing you next month. And put questions in. Happy New Year.